Hi folks, welcome to the Pulse of St. Pete's. I'm your host, Brian Lamore. On today's show, we'll be talking about a health condition that affects 1 out of 8 ladies in our lives. And if detected early, there's over a 95% success rate, so we want to detect it early. We're talking about breast cancer. October is Breast Cancer Awareness Month. You'll see a lot of people wearing pink. On today's show, we'll be discussing more about the resources and opportunities that are available for ladies to have this examination done. Of course, we have some wonderful people here to help us discuss this topic. On my right, I have Pam Sasser. You're an RN with St. Peter's Hospital. You're a health navigator, right?
Breast and gynecological nurse navigator.
Yeah,
That's
right.
a lot to say.
It's a lot for me to remember too, apparently. And Mickey Kunnary, you're a Helena resident and breast cancer survivor. Welcome to the show. It's great to have you all here.
Thank you.
Okay, now Pam, let's start with you. You know, we've talked about breast cancer a lot, or there's been a lot of information in the media over the years, but it's really important that people are aware of what it is and how it affects individuals. Could you tell us more about it?
So just to reiterate, breast cancer does affect 1 in 8 women in our lifetime. It does not discriminate. It can be someone who is completely healthy, has done all the right things their entire life, and they still can get a breast cancer. Certainly there are different things that can trigger a breast cancer, but the key point is it does not discriminate, and everybody should be aware.
Should be aware. And you know, there's some medical guidelines as to when ladies should start looking into the possibility of breast cancer, and it's age related, isn't it?
Well, interesting you ask that because just me personally, we are getting younger and younger women diagnosed with breast cancer that I've been navigating this year. The recommendation, however, is at the age of 40 to start doing mammograms, and it's a yearly mammogram that is supported through the American Cancer Society, the American College of Radiology, Oncology. So there's there's a lot of support to encourage that yearly mammogram. But with that being said, it's also very important for young women, even teenage girls, to start knowing what their normal is by doing their own breast exams. The big takeaway is if there's anything abnormal, to follow up with your provider. If something, you know, feels a little out of place, the doctors would rather you come in and visit with them and make sure there's nothing going on rather than waiting and waiting because you are under the age of 40. So it's really important to know your normal, and when something is out of whack, make sure you follow up.
And where would they start to maybe find out how this process works? I imagine they have their own personal physician that they could discuss it with, but there might be other resources out there also?
Yes. So definitely their primary care provider would be the first place to start. But like, for example, if you didn't have a primary care and you're trying to figure out how to even get involved, there's many, like Planned Parenthood is a great proponent for doing the exams and getting mammograms. I know the health department, if somebody doesn't have insurance, they can go through the health department. People can do a self-referral without a physician for a mammogram. And if somebody doesn't have insurance or is low income, there's lots of programs out there that can help. St. Peter's is one of them. We help with free mammograms throughout the year. So don't let that ever be a hindrance. You know, if somebody is having an issue, there are resources out there. If you have questions or are needing help, they can certainly call me, 495-6780.
Okay, yeah.
And I would be happy to patch them through to the correct person that could help get that facilitated.
You know, take that first step. Don't wait and see if things change. I mean, you need to address it. The sooner you address it, the better the outcome, right?
Absolutely, yep. We're finding that the earlier breast cancer is detected, we have a 95% cure rate. This isn't just survivor, this is an actual cure rate in early breast cancer. So like I say, the earlier they're detected, the better the outcome.
Well, that's great. Well, are there some things that an individual can do prior or in their regular everyday life in order to help avoid breast cancer?
Well, for certain, you know, all your risk behaviors that are good, just overall health benefits, such as diet, exercise, limiting your alcohol intake, limiting your red meats, specific to breast cancer, the cruciferous vegetables such as broccoli, cauliflower, turmeric is a wonderful spice that has helped in terms of keeping breast cancers at bay. Green tea is another. The recommendation for that is at least 6 cups a day of green tea. So if you're not privy to a restroom, because you might have to go to the bathroom a lot, but you could certainly do a green tea supplement too. So, it's just in moderation. A lot of people have questions about sugar, like is sugar off limits? And no, that's not true. You can certainly have sugar, but just don't overdo it.
Yeah.
Just like you wouldn't for any other thing, you want to keep it at bay. Vitamin D, there's a lot of research out there pushing for vitamin D, making sure that women are getting the proper amount of vitamin D. And of course, here in Montana, we can't go out every day and get it from the sun. So you do have to take a supplement. Men also, men do get breast cancer, so it's very important that men are aware as well. I personally have navigated some men here in town with breast cancer, so it's not just a women's disease.
Oh, yeah, I had a friend that had that also. But what I always like to ask about too is cigarette smoking or smoking in general, tobacco. What's your recommendation on that?
Well, of course, I would say to not consume.
Not do it.
Chewing tobacco, smoking tobacco. The big thing now is the e-cigarettes, and
that's scary.
That is scary too because they're not. The FDA isn't controlling what carcinogens are put in there. So it's really important for people to just abstain, if they can. If you are a smoker, we certainly have programs. We have the smoking cessation class, again through St. Peter's, but there's also through the state that we can help if somebody would like to quit smoking. And lots of times, insurance will cover very well in terms of those, like the gum and the patch and those kinds of things. So don't ever let that be an issue for someone stopping.
Exactly, and we have a website, and you can call St. Pete's in general, all kinds of information there. Take that first step, get going with it. Well, now, Mickey, I've heard some people say they don't have to worry about breast cancer because no one in their family has had it. Is that a true statement versus, if it is genetically sent on?
No, I can tell you from personal experience that it's something that's not true. I personally didn't worry about breast cancer because I didn't have it in my family, and I assumed that since it wasn't genetically already in my genes, I didn't have to worry about it, and that wasn't the case at all. So I think that I'm pretty typical of a lot of women out there. When I was diagnosed, I was 42, and I wasn't doing regular self-breast exams. I missed my mammogram at 40. Typical mom, wife, working mom. I'm too busy. I make sure my kid gets in for all of his checkups, but I wasn't taking care of myself. So.
And you're too young.
And I'm too young. I mean, it's all of those fallacies that if the genetics aren't there, if you're not of a certain age. I was healthy as a horse other than having cancer. So I really am one of those people that learned the hard way that this is a disease that can strike at any time to anyone. And so you need to get yourself screened.
I'm thinking they advise you to go to the dentist twice a year, and you do, or at least
and
once.
And you do, yeah.
And what do you do about your physical health? I mean, how often do you have that checked up?
Yeah.
But now, Mickey, how did you discover that you had breast cancer?
I actually found an indentation on my right breast and started feeling around and found a lump, and it was a fairly large lump. And so that happened to be on a Saturday morning. I was in Phoenix getting ready to fly home, and the panic set in. Yeah. I'm in a hotel room all by myself, freaking out, going, what do I do, what do I do, what do I do? And it's like, well, you got to get home. And so Monday morning, I called my physician, got in to see her. She sent me for a mammogram, and within a week, I had done a biopsy, seen a surgeon, and figured out that I was, I had cancer. So I was going to set up to do a mastectomy.
Yeah, and what they say, are you considered an early detection, your case?
I think maybe kind of, but like Pam says, I mean, I've met all kinds of ladies after having this happen, women that are in their 20s and 30s that are getting breast cancer. So I think once upon a time, maybe 40 would have been considered young, but I don't think that that's necessarily the case anymore. And the self-breast exams, if I'd have been doing my self-breast exams, what I found for the lump when I found it, I would have found it so much earlier. I was stage 2 when I was diagnosed. I could have gotten it in stage 1. My chemotherapy wouldn't have been as bad. The radiation I went through, I might not have had to do. I mean, there were so many things that I went through because I wasn't doing my self-breast exams.
Yeah. So what's your advice to ladies out there that are watching, even men too? I imagine it's not much different.
It's very much like Pam said, do your breast exams, do them at the same time each month, do them religiously, and if something's out of whack, go in and get checked. I mean, don't be like I was in that I'm healthy, it's nothing, I'm too busy, I don't have time to go to the doctor. Take care of yourself, because if you don't take care of yourself, nobody else is gonna. And so early detection is so important.
Okay, and one of the notes say, know what your normal is. I mean, the normal is, I guess, not normal for everybody. You have your own unique circumstances, and you have to discover what that is and monitor it, right?
Correct.
Yeah. Okay. But there's some conflicting information, even controversy out there. The frequency and effectiveness of breast exams. Pam, what's your advice on that?
Can you,
Let's see. So that they've been able to reduce breast cancer by 30%, the mammograms.
Oh, yes.
And but about the frequency and effectiveness of mammograms themselves. I mean, are they people waiting longer because they think they've taken it once and they can go, instead of every year, they go 2, 3, 4 years?
There is some misconception out there that a person can go every other year. So again, that's our push, is to make sure people are doing their yearly mammograms. I can speak on behalf of what I see, and people that aren't getting their mammograms done are getting diagnosed at a later stage. So on that note, for sure. And then also there was some controversy not too long ago, just within the past year. A Canadian study came out about mammograms, and is it beneficial to do yearly versus every other year. So we have found that people are getting, if you're doing your mammogram, it's a 30% chance of finding, 30% higher chance of finding a breast cancer than not. So we want to make sure that people are getting their mammograms on time every year.
Does a mammogram find a possibility of a cancer earlier than self-exams?
Yes. Yes, it would. We can detect things, our imaging is so advanced that we can see microscopic disease versus by the time you feel a lump. So I kind of like what Mickey was saying, if you can detect it earlier, so typically, a mammogram is going to show these tiny, tiny little calcifications rather than a person feeling something. So it's really important to make sure you are doing those yearly mammograms.
Yeah, and I know many of the shows we have here is like St. Pete's is getting new machines, new technologies, and to get the best so that you can find out sooner and quicker and solve maybe an issue a lot faster and better for the patient.
For sure.
So that's really nice. But now, as a nurse navigator, can you explain how a nurse navigator would help a lady through the diagnosis and treatment for cancers?
So one of the nice things I like with my job is when somebody is recommended for a biopsy, I get to visit with them, typically that day. And so I kind of already start that rapport. And if a breast cancer diagnosis ends up being, what they have, they already know me, and then I can help facilitate. To quote someone the other day, they referred to the Navigator as the belly button of the body, so kind of the center of everything. And it's true. I make sure that everybody is going to the appropriate provider within a certain time frame, because when you hear a cancer diagnosis, it's very scary. Even though we do have these wonderful survival rates and cure rates, it's still a cancer diagnosis. It is overwhelming. And to have that one person take any bit of that stress off, it speaks a lot to them. And so that's what I'm there to do. I provide them with an educational binder, talks all about the breast cancer itself. It gives them a copy of their pathology report, because when you're in, and you can probably attest to this, when you're in talking to the doctors, you don't really hear anything of what they're saying other than cancer, surgery, and that's about it. So to be able to go back and review all those, I go in and I help take notes, to be able to review those notes and to understand, that there is someone in their corner We have a financial advocate that gets assigned to our patients, so they don't have to worry about the financial piece. They'll explain their insurance, their out-of-pocket, their deductible, their copay, those kinds of things. We just try to make all the stresses that are out there a little bit less stressful.
Oh, yeah.
And then I just help kind of navigate that whole process. If they require chemotherapy, making sure they have the proper information that's needed for that, the resources that are out there. If radiation is necessary, making sure I can accompany to those appointments as well. And then, talking survivorship and all those wonderful things. We have a great community support program throughout the Helena community, which offers numerous classes. I do a women's only cancer support group that meets the first and third Wednesday of every month. So it's a great opportunity for women to network with others, but also for me to keep tabs on what's going on with everybody. Because sometimes, someone will have a question, but they don't really want to bother the doctor with it. So they can come in and ask me, and I'll say, you know what, that's nothing to worry about. Or, yeah, I think you really should go see the doctor. And our docs are so wonderful. They could literally walk from group right to the cancer treatment center, and they would see them that day.
Oh, that's great.
So, yeah.
And Pam, also I know St. Pete's has a medical foundation that people can contribute to, and they have some money that's available to assist individuals, ladies with breast cancer. How do they help them out?
So it's really wonderful that our foundation is there, not only for our cancer patients, but for the community at large. But one of the things they can do with our cancer patients, if somebody's in need of medications and they don't have the money, we have assistance, that they can get their medications that are needed. Just an anti-nausea pill. No one should go without that when they're getting chemotherapy, and our foundation helps out with that quite a bit. We have women that'll request wigs assistance. So we can just get the money from the foundation so a woman has a wig. Nobody should ever go without. And that's what our foundation is there for, and it's a really great opportunity.
It sounds like, the entry point to this is St. Peter's Hospital. You can take care of medical questions, medical procedures, financial issues, line them up with state programs, and even the foundation for other assistance, and then you can help them through the process in understanding it. That's really helpful.
Yep.
Yeah. Well, now we're drawing to a close on the show, and we'd like to get some final ideas. Mickey, what would you like our viewers to remember about breast cancer?
Be vigilant with your body. Take care of yourself. Get your screenings. And if something does come back negative in terms of a diagnosis, St. Peter's Hospital took really good care of me. And I will sing their praises forever, because everybody there took care of me from the moment my diagnosis happened to this day. I still go back. I'm to the point where I go back every 6 months, and going into the cancer center is like seeing old family. So they take really good care of you, but it starts with you. You really have to get in there and get your testing done and make sure that you're monitoring your health.
Don't wait.
Don't wait.
Call them up.
Don't wait, because as I said, mine was way worse than it would have had to been had I been paying attention.
Yeah. And Pam, what's some of your final thoughts?
Well, to just reiterate what Mickey said, be diligent, make sure that you are your own advocate. And with that being said, be kind to yourself. I see a lot of women that really beat themselves up because they didn't feel it in time, or they didn't come in. And the most important thing is you're here now. We're going to see you through. So don't ever beat yourself up over a decision. My brother-in-law the other day said, there's a lot of should-haves out there instead of could-haves. Yeah. So, I could have, I should have. Well, you could and you will. So if you have a question, come in, and don't wait, call me. I don't mind.
Okay. Well, I'd like to thank you both for being on the show and giving us all this wonderful information. It's wonderful to have you here. Thank you.
Thank you.
And for our viewers, again, if you're concerned about cancer, if you have any questions at all, if you want to know where to start with the self-exam, or if you do find something, you can call up St. Peter's Hospital, and they'll start you down the path in which we discussed so well this day. For Pulse of St. Pete's, I'm Brian Lamore. Thank you for joining us.